Welcome to Investing Well. What are you saving for? My name is Craig Richardson and I'm a stockbroker, financial advisor and care fees planner. Long-term care is a massive issue just now. It's estimated that there are more than 3 million people in the UK who are aged over 80 years, with a large number requiring some form of care. There has been a sharp rise in the need for dementia and Alzheimer's care, but 1 in 4 people currently in care are estimated to suffer from diabetes. This is relevant because the costs of care are so high. There are options available that are specific to long-term care and people with poor health, including those who suffer from diabetes. Care is not free. In England and Wales, you're required to meet both personal and non-personal care, although there is a nursing contribution awarded, and there will be a cap on total costs from nursing care in England and Wales from 2016. In Scotland, the cost of nursing care is deemed to be free, but there is no proposed cap on non-personal care or accommodation. Very broadly, the average costs for care are similar across the UK. According to accountancy firm Lang & Busen, who estimate the average cost to be in the region of £27,000 per annum for a care home on average. But if you look at the costs published by some of the private care homes, then it is likely that the cost of care is going to be more, and maybe nearer £800 to £1,100 per week, which equates to £41,600 to £57,000 each year. There are state benefits that you may be entitled to claim, but your local authority can insist that you self-fund if assets are above around about £24,000. This limit includes the value of your house. However, there are circumstances where the house can be disregarded. The costs of care are high and they start long before a person goes into a care home. Many people are going to be deemed to be self-funders, so what can you do about it? A lot of people worry about the house and preserving assets, but the core point to remember is the local authority is primarily concerned about the welfare of the person in care and making sure that those that have the means to pay do so. If there is enough income to meet the care costs, then no planning is required, but people will normally have a shortfall, and this can be funded by generating an income out of existing investments, shares or cash. Investing Well aims to give you the tools to help you make your own investment decisions. But there are some areas that you really should take financial advice on. Long-term care planning is one of them. One option that should be considered, particularly if the individual suffers from diabetes and or other health issues, is an immediate needs annuity. An annuity is simply a life company's promise to pay you an income for the rest of your life, and the amount they pay is dictated by how long they expect a person to live. This expectation is reduced when a person suffers ill health, including things like diabetes. This can lead to quite a high level of income, and this is guaranteed and tax-free if it's paid directly to the care home. Immediate needs annuities are like pension annuities in that you exchange a lump sum with the annuity provider in return for a guaranteed level of income. Annuities are great for that, but their great drawback is the risk that the individual might die earlier than expected, thus losing most, if not all, of the lump sum. Annuities are not a silver bullet, but they are useful. And as I say, this is a complicated area, and financial advice should in most cases be sought. The family may decide to simply buy an annuity which meets the care costs. They may decide to use the existing assets to generate a level of income to meet the care costs, or they may elect to do a combination of both. Investing Well provides you with the tools to make your own investment decisions, but access to whole market independent advice should you require it. So what are you saving for?